Hello again, ladies and gentlemen. Welcome back to your favourite podcast, the AJR Show. Today we are joined by another specialist and expert, Dr. Teck Khong. Doctor, how are we?
Good morning. Good morning, Andrew. I'm fine, thank you. Thank you for the invitation to speak on your very, very nice studio, I must say.
Yeah, I've gone for a little bit of a change in that. I like to change things up. My wife's always having a dig at me for constant. I can't just sit still. I seem to change things up every 5 minutes.
You can congratulate her for me. It's really impressive.
Yeah, she keeps me on my toes. Ladies and gents, I wanted to get Dr. Khong on the podcast. He's a GP and researcher and an absolute leader in what he does. And I'll let him obviously explain more. He's UK based and does fascinating work. And I think his message and his experience is vitally important to share with you guys around what's been going on over the last couple of years, especially. So Dr. Khong, if you wouldn't mind, just giving the audience a bit of a broad overview of your experience and what you're doing now.
Well, if I may say, I was a graduate of Sheffield University. I qualified in the late 70s. My initial direction was in hospital medicine. So I went to Leeds to what they call a SHO registrar rotation in medicine, which covered various specialties. I went from there on to clinical research in rheumatology because I had a very early interest in pain management, and I was a research registrar with the Rheumatic Centre in Glasgow. That set the trend for me as far as interest in medicine went in later life. I went into general practice in the 80s, and it was quite an interesting time because we were in a state of flux. The National Health Service was undergoing fairly regular changes, but they were mainly tinkering around administration. When Tony Blair came into government in 1997, we had a health expenditure of around 38 billion pounds. When he left, it was in the 110 billion. And what amazed me was that although there were strides made in the delivery of medicine because of scientific advances all over the world, as far as patient access is concerned, it was very patchy. There were some improvements, but there were also some drawbacks. But one of the high points for me was the way the National Health Service was being outsourced to private providers. And I remember very clearly Ellen Milburn signed a concordat with the private sector, and we started engaging with the private sector in a manner that was described as privatization. From my perspective, I worked in a very poor area of Leicester. It was one of the bottom 10 poorest areas in the country. So I was very conscious of accessibility to good healthcare for the poorer people. So one of the things I did was to understand if the national trend was towards private providers, how could I empower the poorer people to have an equitable status in the changing face of our health service? Because the better off we're able to afford private healthcare, the middling group were in some ways pushing the boundaries in a new health service, but the poorer people by and large were left. And they were left in a way that was exacerbated by the use of financial targets for doctors. So eventually the tripartite compact, which consists of taking money, taxation from the people, paying the medical profession and the various medical services to look after the people, that compact was distorted by the use of financial incentives. So eventually we find a situation where doctors were, either by necessity or by ethos, because of the presentation to them, they were guided by money rather than the need to lead in clinical care. And I don't mean this in a very dismissive and condemning way of my colleagues. It was the climate. So, for example, I found myself in an invidious position where I was actually rated very highly in the newspaper in Leicester Mercury as a very favored doctor. But by the same token, I was scoring very badly. So my time was spent in looking after people, but not chasing targets, to the extent that I was starting to show what they perceive as a weakness in my performance, when really the performance was measured by financial targets. As far as I was concerned, the role of a doctor was to assist the to get the best health care. So my energies and my concentration was on the patient. So from that point on, it became my mission in life to actually champion those people who were left behind by a system that was more and more micromanaged, to the extent that the values of medicine were corrupted. And we find ourselves, if we fast forward to the present day, we find ourselves in the grip of a political class that's more and that I find very disturbing. So when the pandemic was declared, one of the things I noticed was there was a remarkable speed at which vaccines were developed. And, you know, with my research background, I was particularly conscious of the fact that these products, I would call them products at this stage, in clinical trials were taken off the clinical trial status and rolled out en masse to the population. And it's not just in this country or America, it's worldwide. So that rang some alarm bells, because it is quite unusual for a pandemic to be managed virtually exclusively with what is essentially an experimental product. Not only that, I found that because it was rushed off, there were certain checks and balances missing. Now, when I conducted clinical trials, excuse me a second. When I conducted clinical trials, they were conducted under very stringent conditions. We would monitor those people who accepted to be in a trial with constant monitoring of their vital signs, their biochemistry, their hematology, and whatever is necessary to ensure their safety. And if anything untoward developed, we would obviously act appropriately, take them out of the trial, break the blind to find out what they're on, whether in placebo or the product being tested and so on. But, you know, when the vaccine was launched, there was nothing of the sort. We would say to people, if you get COVID, isolate. I think I was about the only GP in a wide area who actually bothered to ring up the patients and say, how are you feeling today?
Yeah.
So we lack the follow-up, we lack the patient care, we lack the sincerity.
Regarding the patient and clinician sort of relationships now, that's almost pretty much diminished, hasn't it, because of the protocols that have been put in place, which has been quite alarming to see. And then, you know, you mentioned obviously the financial incentive side of it, and it's been clear and obvious, hasn't it, over and they've not even hid it, how many doctors have been paid per vaccination that they've given over the last couple of years. And, you know, if you're going to get paid per vaccination, you're not going to be in a rush to see Susan with an ingrowing toenail. So, you know, I totally get that point. And and you're not the first doctor I've had on, even, you know, outside of the UK as well. Even Dr. Peter McCulloch said that he would, you know, there's nothing wrong with just ringing your patients and seeing how they actually are. But that whole patient and clinician relationships is completely diminished almost, hasn't it, here in the UK?
Indeed, Andrew. What I thought was this. So we have this medication or product that's rolled out to the public upon suspension of clinical trial status. So we vaccinate the people with the bearers of information. Now, as you know, when we conduct clinical trials, in phase 3 especially, we give people information upon which they can make a sound decision, a freely given decision to say, yes, I will participate or I will not. In this situation, there's barely any choice, and there's a very strong pressure on them to accept the vaccination. We know there is a dearth of safety data. There is hardly any explanation how the vaccine works. It is treated as if it's a conventional vaccine, which it's no further from the truth. And we also have a huge cohort of operators, vaccinators, doctors, who are not allowed to discuss things in a cogent manner. So we have people saying, "Oh, this should be all right," or "You've had your first dose. How was it?" And say, "Well, I had a bit of problem with this and the other, aching." And "Oh, you'll be all right. The second time, it'll be a lot easier." And I overheard this sort of conversation. I think it's very unacceptable, even unethical. So the first missing point is a lack of informed consent. And informed consent comprises at least two things. One is to give people adequate information upon which they can make a freely given acceptance. The second is, if they decline, then there should be an offer of what the alternatives are. And the rollout of the vaccine has vastly overshadowed any effort to find ways of dealing with COVID. So if you know, COVID is not uniformly lethal, we should have spent time on finding out who are the susceptible people, why and how the people are susceptible to various pathologic mechanisms behind it, and how we can protect them, and how we can treat them even with either novel drugs or established medication. Doesn't matter. But the effort, the money seemed to have been spent on the vaccines. Now, once the vaccines have been given out, where in a normal trial situation you would find out, you would monitor the biochemistry, hematology, and so on, as I mentioned, there was a lack of that. Not only was that lack, it was compounded by a very censorious environment. We were not allowed to discuss with colleagues, with people, either on social media, whatever it is. There was a virtual embargo on any sensible discussion, and that is extremely unhealthy, even dangerous. Science doesn't progress by prohibition. Science progresses by inquiry. So I find that very disturbing. So be that as it may, I held a very open view, and although I didn't participate in the vaccination program, I continued to see patients. I followed their micromanaged style of new era consultation, where you would phone people up, but I would call people in whenever there was any need. When I perceive a need to see them, to understand the clinical presentation better or to establish a diagnosis, I'll call them in. As time went by, I started noticing a relationship between vaccination and the appearance of some very unusual clinical presentations. So I would have people saying, "Oh, I saw Dr. So-and-so with this rash," and it was treated as if it was a fungus, and then it was treated as if it was a bacterial infection. But all along, there was some bizarre presentations in people with no dermatological history. I would come across young people, and there was a celebrated case I spoke about on LBC. There was a young woman, aged 27, who after vaccination developed a very swollen arm. And it wasn't the arm on the side of the vaccination, peculiarly. And so I did various tests, including a D-dimer. Because I work only part-time upon early retirement, the results came to my colleague, and he thought it was very unusual for a very healthy gym fanatic to have a D-dimer taken. Anyway, with the presence of mind, he referred her to the hospital, and again, they were surprised. But again, they had the presence of mind, gave her anticoagulation, and within 3 days it settled. But in the interim, she had ultrasound determination of whether she had thrombosis in her veins and so on. They couldn't find anything because I believe this was not a case of sizable clots, but microthrombi. And since that case, I picked up rather a lot of cases where there were clot formation in various places, some presenting as abdominal pain. So we have a massive problem going forward. Whilst I would not condemn the efforts in finding a vaccine to deal with this, I think there are various surrounding mechanisms and support structures that need to be put in place, certainly in the interest of patient safety.
Yeah.
So it's to my dismay that these things, 2 years on, we still lack. Now I think there's a bit of a climb down, because this morning I saw in the news that Sajid Javid said that hopefully some of the restrictions will be lifted by March. Yet I was at a meeting on Monday where nurses and physiotherapists, dentists, they were all packed into the meeting room, anxious and distressed about the imminent mandate to be vaccinated. Otherwise, they would face unemployment. So that's a very draconian measure for people who have dedicated their lives to a vocation of helping the sick and the poor. I just think it's beyond belief.
You know as well as I do that these NHS staff, no matter what their role, have for the last 2 years worked tirelessly throughout all of this.
Yes.
Not only that, right now, and you've got to bear in mind, I receive tons of DMs and emails every day from doctors and nurses who are speaking out about their frustrations about what's going on and actually describing what's really happening on the ground. Like, doctors and nurses across the whole country who are unvaccinated are currently having to work extra shifts to cover those who are currently sick with COVID, who are triple vaccinated and often double vaccinated, where all the unvaccinated people aren't getting ill with it. And they're between now and then are being expected to just buckle up and just put up with it until such a date where they're going to be struck off. Now, it's not only immoral, unethical and unlawful, it goes against all, so many human rights, the right to work, against so many of the Nuremberg Code. It's almost as if these governments around the world have got a copy of the Nuremberg Code in one hand and the Declaration for Human Rights in another, thrown them on the floor and just stamped all over them. That's basically what they're doing and have done for some time now. And it's really, really alarming and quite distressing. They've obviously got a plan in place, because the 60,000 care workers that lost their jobs, that's unfortunately it's almost been forgotten about. But what they're doing is, and we can clearly see it's happening, is they're replacing these care workers with migrants who are coming in by the hundreds on a daily basis into the UK. They pretend that they're doing something about it, but they're not. And the migrants are filling their positions, and because they're not UK citizens and they're not even really trained, they don't have to have the vaccination. So they've removed people from post for not being vaccinated and replacing them with people that don't need to be vaccinated because they're not UK citizens. It's just non-stop crimes against humanity.
Andrew, it seems that you can have a complete catalogue of all the negative adjectives that can be applied. The government seems to be carrying these things out with no compunction. The government seems to lack leadership. It doesn't have to follow this worldwide edict of mass vaccination. It can easily break away and show leadership in how best to do it. But it seems to follow sheepishly a dictate that comes from a central source. It's a central command that I find disturbing.
Yeah.
People are treated in a very dispensable way. There is no longer any compassion in the care. It's all false. It's all artificial, and we have a huge propaganda war going on, where the people are so disposable. It is utterly disgusting.
Yeah, it really is, and it's it's a daily battle, I find, to get my head around it, and nothing surprises me anymore when you see, especially when it comes from the central commanders who's running things. You can clearly see that our government isn't running the show. There's like some kind of shadow government which are just using them as puppets, like, absolutely. And we know it's very much coming from like towards the top of the pyramid, where you have your Bill and Melinda Gates foundations and Rockefellers and Rothschild families and stuff like that, and it all filters down, which is what is happening all around the world. It's extremely alarming. I think people are only just starting to learn about this now. I'm finding that the way the government here is acting is going in our favour in terms of like the amount of people that are now coming to realise and coming to their senses that this is very sinister, and it's not in the interest of the people whatsoever, which is good from our perspective, because we need that to happen. We need everybody to start early opening their eyes and seeing what's happened, and that unfortunately people have been tricked into a medical intervention that was not in their interest whatsoever, but actually has caused grievous harm and death, and has led people to do what they're doing around the country, in terms of creating police criminal complaints, and that was just what we've done over the last few weeks, and which has empowered people to do the same around the country, which has been fantastic. But I mean, you said earlier, you witnessed a lot of people coming through with all different types of ailments obviously from the vaccines. And I know one of the big things that's been quite frustrating is that, and again, I get people messaging me every day. I get floods of messages, people saying they're suffering from this or suffering from that, or someone in their family is, and their doctors and GPs are refusing to link it to the vaccine, when before that they were perfectly healthy. You mentioned that you've seen quite a lot of that.
It's very sad. It's very sad. I think the blame is not just on the doctors refusing to make a connection. There is some naivety in believing that the government is right, and there's also a very misplaced trust on the official narrative. But I find most disturbing of all those two other things, on top of that, is the censorious attitude that there is no right to speak about it. So my colleagues who are afraid to speak or afraid to make the connection, I think they have become very sadly detached from the ethos of medicine, which is the care of the patient. I mean, I was very concerned last week when I was on call, when I was actually on duty in the hospital. A nurse came up to me, a senior nurse, said, "Oh, I'm about to discharge this 15-year-old boy." And I said, "Well, what's wrong?" "Well, he's got some aching chest and he'd been for football training." But I couldn't find anything wrong. I did all the vital signs and even did an ECG, and they were all normal. So I started asking about the background to it. He says, well, he had COVID at the end of December, isolated for 10 days, and felt well. So he went to his football training. He's a very reasonable, sensible, middle-class boy, attended casualty with his mother. But the history transpired that late in September, early October, he had his first COVID vaccination. So I said to the nurse, I think we better do these few important tests, and just ask the parent and the child to wait in the waiting room, and when the results come in an hour's time, we'll deal with it accordingly. Less than an hour passed, and the nurse came scurrying into me, to my room, and said, "Oh, those 3 key tests that you wanted to do, they're all raised. The troponin was 10 times above normal. The D-dimer was elevated, and the creatine kinase." So she said, "Well, what shall I do?" I said, "Well, just get him transferred to the cardiac unit." She was going to call the registrar down to reassess. I said, "There's no time to reassess." I said, every time when she was away, I said, every time the boy ran for the ball, he got tight in the chest, and towards the end of the training session, he became a bit short of breath. Well, sat in casualty when he was quite calm. Everything seemed all right. ECG was all right. So here we have a lack of information given to the public about things to look out for. We also have a lack of information to the healthcare profession who look after patients to be on the alert and be vigilant to pick these things up. I think this approach, this micromanage approach, is very, very flawed and potentially dangerous.
We're seeing it in Australia as well, like more so, and on the pressure on the doctors and the nurses. I've got English friends over there in the healthcare profession, and they've literally just been like told, if you talk negatively about the vaccine, you will lose your job, you will get struck off.
Yes.
Now, if I'm being, forget about the actual vaccine, like any product, there's products a million times over around the world, right? If you're being asked to advocate a product, like, if it was that good, why would you be threatened with your license or your job about it? It just doesn't make sense, does it, whatsoever? And it's threatened with your livelihood and the fact you can't feed your kids if you talk negatively about this product that is now very much part of your system.
Absolutely right, Andrew. Absolutely right. There are huge gaps in the way the policy is presented. It assumes a total lack of immunity on our behalf, and we're not supposed to have our defense mechanisms. There is no other way to treat it. It is uniformly lethal. I mean, for example, a few months ago when ITV announced, and I was watching the TV with my wife, she said, look, so many thousand cases, 10,000, 30,000 cases, whatever it is, and there were so many deaths. So I instantly drew up my calculator and said, look, here it is. Number of deaths divided by number of positive cases, and it turned out to be 0.28%. And then on another day, the same was done again. Today, there were so many positive cases and there were so many deaths. I said, there again, it's less than 1% again. It's incredible. I think there's a lot of disingenuous way of presenting the news, and every positive case is drummed up in a very alarming, fear-mongering fashion.
It doesn't mean infected, does it? Cases don't mean infections. And that's what people just, they don't understand the difference.
I really don't understand how and why this huge gap between reality and the seriousness of the condition is being exploited.
Yeah, I mean, again, we've seen it since day one. Obviously, the behavioural science, the propaganda, the NLP being used on the public, especially when it comes to using numbers and graphs and stuff like that. And I was when I read yesterday, like, they're going to lift all restrictions, take away, mask wearing and all this kind of stuff. I was hoping to see in there, like, they're going to get rid of their modelers as well. Yes. But that didn't happen because they have got every single thing wrong, like everything. There's nothing that's been right whatsoever since day one. And yet they employ these people as like very highly paid civil servants, which have done nothing but scare the public. Like, that's all they've done, using graphs. Now, people seem to forget, it was only some time ago, 14th of December, in fact, they were saying they're expecting 200,000 Omicron cases, and it's going to double every day. I remember doing a social media post where I was saying, if that's what their numbers are showing, it's going to double every day, then by New Year's Eve, we're going to have 26.2 billion cases in the UK, meaning that everyone's going to get COVID 374 times in a day. Again, it's just all like, well, we know why, because the media is completely bought and paid for by the powers above, and they do what the hand feeds them. But the fact that they pump out this information and scaremongering statistics is just, I've never seen anything like it in my life. The fact that they could just get away with it, because they've been wrong every single time and far, far, far from the truth.
I'm not sure whether you came upon an interview that Fraser Nelson reported, that he interviewed a chap in the SAGE committee, and he was supposed to model on the worst case scenario, and all the government plans and policies were predicated on the worst case scenario, which in the majority never really happened, did it?
Well, no, but I mean, you could make up a worst case scenario for everything. Anything in life, you could make a worst case scenario. And if we lived our life like that, nothing would get it done.
Absolutely. But the sadness is, lives have been damaged, livelihoods have been destroyed. Where is the conscience of a government that's supposed to be elected democratically to look after its people? And that is why I personally have taken up the offer of being a member of a people's party called the Alliance for Democracy and Freedom.
Brilliant.
I'm not here to make enemies of anyone. I'm here to help people restore sanity and normality in their lives.
Fantastic. Do you want to explain a bit about more about that alliance and what you're doing?
Yes, I mean, when the Blair policies affected the way my patients access healthcare, I mean, there were people coming to me back in the early 2000s, late 90s, saying, look, could you, doctor, please change this NHS referral to a private one? And I said, look, it's going to cost an arm and a leg, you see. He says, but I can't wait for my mum or grandmother or granddad waiting for the prostate operation to continue suffering. We'll pay for it. So that encouraged me to look at an augmentative policy, and I then worked with AIG to produce a special policy price well below the average, because it only kicked in when there was an inordinate long wait. Anyway, the long and short of it was that showed me that a lot of people depended very heavily on the doctors being the advocate, and I think we should return to that ethos of genuine care. I don't have a problem really, if targets are to be set, they should be set at a level that reflected care and not reflected managerial penchant for showing signs of various things. I mean, to come back to the point, I think going forward, we need to be clear where we want the country to be. So following the Blair years, the early Blair years, I became very disenchanted with the way health policy was managed. So one of my patients, called Mrs. Pullen, she was a conservative councillor. She said, look, if you're so passionate about healthcare, why don't you take up politics? And I had no idea what politics was about. And this is what I want to say to people. Politics is not something very esoteric or very difficult to do. It's dead simple. If you've got a passion to help people, if things that are affecting you in a way that should not be, if policies are upsetting the way you conduct yourself, then I think you really need to do politics. So I was introduced to the conservative hierarchy. In those days, I couldn't care whether it's conservative or Labour or Liberal. All I wanted to do was my patient. So I presented a 4-page document to Tony Blair and to, at the time, the leader, William Hague. And I was invited to meet with Oliver Heald. In those days, as Oliver Heald, chair of the Commons Select Committee on Health. And they liked what they saw, and they said, well, would you like to sit the parliamentary assessment board exam? And I did, and I became a parliamentary candidate for the Conservative Party. But I fell out of favor because I didn't spend enough time campaigning. I was a single-handed GP. I also spoke very strongly on Brexit, so I got deleted from the list. I remember Roger Helmer saying, well, if you're so passionate about Brexit, come across to UKIP. And I did. And, I lost my deposit fighting in the same seat that I helped gain an extra 10,000 majority for my MP. So I thought, I'm giving up politics. And then I was invited by a group of people that formed this party that got registered on the 20th of August, 2020. And I like the ethos of it, which is basically, there are no egos. We are here to look after the people's interests. There is a wealth of electoral experience, because the members come from all sorts of political backgrounds, but all unified on the basis of serving the people. And that's what I like. I think
Absolutely.
if you're in politics, you're there for the people, you're not there for yourself.
Mm-hmm. Well, I mean, look around us. Like, can you see anyone right now who's doing or taking action for the people? Absolutely none.
Yes,
none.
I think it's very important that we get it right. Britain was at the head of one of the largest trading blocs in the world, and we had the Ottawa Empire Conference back in the early 20s. I think there was one particular one, 1923. And then 50 years on, Britain turned its back against the Commonwealth and entered the EU. And from there on, the designs and the ambition of the what started off as an economic community became clearer and clearer. So I think we should work on the fact that we can recover our ascendancy. I think Britain should take pride in the very long history of leading the world in various advances, technological advances. We can do it, and we should do it, and we should do it with the people. And this is what I want to say, that we should have confidence in our country and have pride in our people. We should look after them, and they will look after us. Look after the country, I mean.
Yeah, absolutely. And again, I was quite fortunate to interview Ricardo Bosi from the Australia One Party. He's a former military man, ex-lieutenant colonel, and the way his party set up is like really quite interesting, and I find it much better than what we have as in a parliamentary level. And this is just my personal opinion. What I'd like to see is Parliament removed and have almost like a round table, a think tank of leading experts who are leading experts in that field. So I don't mean a banker being a health secretary or an economist. I mean a world leading expert in that field, and then replicate that round table in major either counties or major cities around the country. So you have a sort of centralized think tank, and then obviously a sort of round table in each of these major cities or counties as well, so for the people, because obviously collective ideas are so much better.
Yes, even that, Andrew, is slightly flawed. In our party, what we have is, unless you actually have frontline experience in that specialty, in that sector of industry or whatever it is, then it's inappropriate to put you there. So I personally think, for example, you're quite right. It's no point having a history graduate or a former postmaster or a banker who run the health service. Neither do I think it's appropriate for a doctor to run, say, Ministry of Defense. We got to have some specialism in what we do and justifiable experience. The other thing about the Alliance for Democracy and Freedom is the three words are key to it. So we started supporting independent candidates who do not wish to be under any central ethos of a party. That's fine. We don't have a problem as long as the theme is about service to the people in the community. That falls within the remit of this organization. So that's on the alliance part of it. The next part is democracy. We like to establish democracy, re-establish democracy the way it's meant to run. So we have no central command system. It's not for us to whip, say, a councillor in Reading what to say or do for the people in Reading, because if we are based at the moment, we're based in central England, we don't know the circumstances there, the situation there, so we leave them to decide. And we keep national policy to a minimum, and it should fit the national picture that's suitable for everyone and suitable for our country in the international arena.
Absolutely. And where can people find more information on the Alliance Democracy?
Yes, it's very simple. It's adfparty.uk.
adfparty.uk.
Yes.
Awesome. Dr. Khong, I just want to take this opportunity to thank you for taking your time out of your busy schedule to share your wisdom and in your experience over the last 2 years, especially with the audience. I'm sure many people got a lot out of it, and it's great to see you advocating so hard for the people and being very much part of a different party, which is all about that. And it's brilliant for you to share about that. And I encourage people who are watching to go and check out the website that you just shared there, adfparty.uk. I'll obviously put that in the show notes. And because this is where we're at right now, I believe, is that people want to see movement back, very much towards and aligning with these key areas, freedom, democracy, because it's very much being eradicated at the minute, not just here, but in other countries around the world. What we're seeing in Australia, New Zealand, Canada is just deplorable. And it is, in your face, downright tyranny that we thought we got rid of, in the 40s. I'm just seeing countless reports and videos and that of, police and people go around checking people's passes. It's literally 1942 Germany in some of these countries. So for yourself to be aligned and doing great work with that to restore those key British values to our nation is absolutely fantastic to see, and I'm really proud to have you on to share that.
A thought just crossed my mind, Andrew. Just think about your own personal life. If you were shackled, would you be able to achieve even the slightest percentage of what you have done today?
No.
I think freedom for us to pursue our endeavors is the best way forward for all of mankind, and there's no two ways about it.
100%. Exactly that. If you can't go where you want, do what you want, say what you want, you don't have freedom.
Yes.
Simple as that.
Freedom, of course, freedom with a conscience, but freedom, yes, indeed.
Superb. Doctor, thanks again for coming on. Ladies and gents, if you enjoyed today's show, I'd really encourage you to share it with your family and friends, no matter where you are in the world. I'm sure you've taken a lot from it. Dr. Khong's wisdom is absolutely fantastic, and his experience speaks for itself. If you haven't done so already, please do subscribe to my Rumble channel. Those of you will be aware that I'm no longer on YouTube. They're starting to get a bit fed up with me, I think. So please subscribe to the Rumble and the BitChute channel as well. And please subscribe to my Telegram channel, where I'm going to be putting a lot more content on there as I move away slightly from sort of Facebook and not so much on Instagram, because my accounts are getting hammered with bots. So I'm trying to make, obviously, the best viewing experience and content experience for everybody without all of that aggro. So most of my content now is going to be on Rumble and on Telegram. So please make sure that you tune in and subscribe to those channels, ladies and gents. Look after yourself, boys and girls, and I'll see you very, very soon for another awesome episode on the AJ Roberts Show.